Hi, my name is Joe Edelman, and welcome to my presentation of Community Paramedicine. This is for Columbia Southern University, EMS System Design with Dr. Reiner. Community Paramedicine, or sometimes referred to as CP throughout this presentation, is an innovative and evolving model of community-based healthcare designed to provide more effective and efficient services at a lower cost. Community paramedicine allows paramedics to function outside of their traditional emergency response and transport roles to help facilitate more appropriate use of emergency care resources while enhancing access to primary care for medically underserved populations. Community paramedic programs have become essential to many local emergency medical services within the past few years. Many of these programs have been highly successful, while others have failed. As EMS programs around the country join the progressive nature of the program like community paramedicine, there's enough data collected that it is possible to learn from the trendsetters. Gathering information on how other projects have been successful and understanding what has made these projects flourish can be an intricate part of starting a program within one's own department. We will look at how we can easily fund our project and the expenses that we can project. The initial step is going to be to contact the New Jersey Office of Emergency Medical Services to request legal clarification regarding any regulations of our hospital-based community paramedic program. We're going to connect with other healthcare partners in the counties we provide services to and assess the community health needs. Together, we can develop a plan to meet those needs. We're going to start with building a team. As we build, our plan must remain fluid. And if barriers arise, we will overcome them and be acceptable to change. Our plan involves reducing readmissions to fund the project. It is a windfall for our hospital. A budget will allow us to satisfy the stakeholders regarding financial stability. The community paramedic team members will develop an education and training plan that will be vetted through leadership. And lastly, the evaluation of our plan by both the stakeholders and the client is essential to our success. Medical oversight will develop a QA and QI process so that we can maintain the high level of service that we pride ourselves within our department. We will initially utilize medical oversight that is set up with our Advanced Life Support Department. Standing orders, medical policies, and procedures will be vetted through the physician. There will be a job description developed, and this will remain fluid as we build this team. Our cardiology team will be an integral part of our referral success. There will be brief yet essential on-site meetings to discuss our plan and our goals so that the doctors are in line with our mission. You, our stakeholders, will be asked to continually evaluate the process for success. Initially, we would like to have bi-weekly online Teams meetings to keep you, the stakeholders, well informed. We will start with a small and focused group on one or two needs that will be quickly addressed. Prove the value of our community paramedic program through the patient improvement, satisfaction, and appropriate or inappropriate resource utilization and other measurements. We will then add new services only based on observed or proven needs or at the request of our healthcare partners. The project must maintain our sustainability. Our public health goal is to build a community paramedic program that will serve the residents of Southern New Jersey. With a few more adjectives, this might even be our mission statement. As we have developed a plan for success, it is important that we have a vision. The logic model shown here will guide us and help us explain the community paramedic program to our internal and external stakeholders. Once we establish our program goals, we can then move into the activities of the program. The activities will help develop into our outputs and finally the short, intermediate, and long-term outcomes. Over the next few slides, we will discuss this logic model for a better understanding of the proposal for a community paramedic program. The program goals, our site of operation is going to be Cumberland, Gloucester, and Salem counties for the time being. Our partner resources, local hospitals, county services, and cardiac physicians. Medical direction is going to be handled by our current medical director, our medical command. The stakeholders, our external stakeholders, are primary care physicians and cardiac care physicians, local government officials, and community leaders. And our internal stakeholders are the hospital leadership along with ground transport leadership. Next is our activities. We have plenty of activities that are going to be involved in community paramedic program, such as home safety evaluation, fall risk review, medication review, vitals and physicals, vaccines, CHF care, COPD care, end-tidal, CO2 monitoring, community services notifications, weight management, fluid intake management, edema assessment, blood sugar assessment, and we're going to even help arrange for transportation services with the help of our community partners. And our outputs. Referrals which will lead into the hub of our program, which is the clients or our patients. Our short-term outcomes for our patients and our clients. The advertisement of a community paramedic program for better awareness, ensuring a no-cost benefit to our patients and our clients, the development of a patient base, and ensuring the program satisfaction. To our providers, we want to develop a community paramedic team with paramedics who are well trained. We want to have primary care physicians and cardiac care physicians referring the appropriate patients. Intermediate outcomes, we want to begin to chart data of client compliance of patients to medical and social services suggested by the community paramedic team. We're going to expand the program with more providers, and then we will expand partnerships with government services such as transportation and social services. The long-term outcomes. It's essential that we decrease the frequent flyers. We need to decrease early readmissions to the hospital. We need to increase EMS awareness in the public and increase staff participation in social health care and increase EMS presence with cardiac patients. The community paramedic program is proposed to be financially secure with no outside funding necessary or with an increase in operating expenses. The idea is based on reducing readmissions to the hospital. In a report by Karen Shore, PhD, quote, hospital readmissions within 30 days of discharge are costly to the healthcare system, an estimated $41.3 billion nationally in 2011. Supporting this financial burden report is a study by the Healthcare Cost and Utilization Project, a division of the United States Department of Health and Human Services. This report states that the less than 30-day readmission rate was at 14% of the patients studied, and at a cost to the healthcare system of $15,200 per incident. In our proposal, this is how we plan to fund the first year of our program. If we have 100 clients, we can expect from national averages that 14 of them will be readmitted under normal circumstances. If we use the value of $15,200 per readmission, this would be a loss to the hospital of $212,800. In the year, that will cost the system $851,200. With the community paramedic program in place, if we reduce the amount of readmissions by only 50%, and I think we can do better than that, that would essentially be a savings of $425,600. On the next page, you'll notice that our operating budget for the year one will be $253,800. This is a realized savings of over $171,000 to our hospital system. There's a lot of information on this page, and I'm going to make it available in print for anyone who wishes to review the details. The bottom line of the proposed budget is the expenses of $253,800 within the first year, and that's more than affordable based upon the savings with the reduction of early readmissions. The building of a logic model will lead to evaluating the program. It will be important for the evaluation team, if looking into the process or inputs, to consider what resources or costs were involved as a result of the program. In the textbook, Evaluating Public and Community Health Programs, the author, Harris, offers an excellent overview of the outcome-based components of the logic model with this statement, quote, "Outcome questions are concerned not with whether the program is working, but whether it has made a difference," end quote. The process measure focuses on how community paramedicine services are provided. Here are some very poignant examples of process measures related to community paramedicine. The number of patients that are enrolled in the program, the number of patients who graduated from the program, the number of referrals to the program from a hospital or primary care, the number of patients receiving referrals to primary care or social services, the number or the percent of patients contacted within the first 48 hours of discharge, the number of medication reconciliation encounters that were completed, and lastly, the number of stakeholder meetings that were held. Are the outcome measures, which focus on health outcomes and the overall results of the program. Here we look at the number or the percent of 911 calls diverted from the emergency department, the percent of patients reporting improved quality of life, the percent of patients who establish a relationship with a behavioral health services or a case management as required, the number of percent of patients with a documented care plan, the number or percent of patients readmitted to the hospital within 30 days of discharge, and lastly, the number or percent of medication issues documented and patients referred to a primary care provider. So let's begin to move forward. Our community paramedic program initiative is built for success. Using the SMART mnemonic, we can answer many questions before they become problems. Specifically, who? Our ALS service. What? Community paramedic program? Where? Our service locations in Gloucester, Cumberland, and Salem counties. Why? Because it makes sense for the public and our project. Is it measurable? It is essential that we measure readmissions of the patients that are enrolled in the program. This will be the financial barometer of our success. Next, we want to measure the number of patients that are in the program versus those that are recommended to the program. This will involve some participation from our partners. Is it achievable? The answer is yes. Failure is not an option. Is it relevant? This program is in line with the mission of our department, as well as the mission of the hospital, which is to provide a safe and compassionate experience that improves the health and well-being of our community by placing the safety of our patients and support of our employees at the center of everything that we do. And the time. Starting this project will take about 2 weeks after approval from leadership. Hopefully you haven't heard it here first. There are no silly questions. I'm here to answer anything that you would want to know about our community paramedic program, and I thank you for your time. Let's not forget about the references.